We've convened this meeting because we think it's important to bring people together from around the world to try and improve access and equity of access to diagnosis and treatment of cancer at a global level. As far as I'm aware, there wasn't a meeting like this that currently happened, and so we thought that it was important to put it on the map as increasingly people are becoming interested in this area. And also I would say particularly the younger generation of healthcare professionals are particularly interested in doing their part. And I think sometimes people don't know how they can help, and so I think that one of my aims of this meeting is that people can learn how best to collaborate and how we can help share the skills and knowledge that we have with people in other parts of the world. Absolutely. So I think that in low resource settings we have to think outside the box and how we can use the resources that we have to deliver cancer care. I think that cutting and pasting what we do in high income countries, as has been said today, and putting that into a low resource setting is not appropriate. And I think also we have a fantastic opportunity to learn how things can potentially be done better than we do them here, and a better, more efficient use of resources. So yes, I think that this should be multidisciplinary. It's going to involve people from all kinds of fields, from health economics, policy, anthropology, medicine, nursing, pharmacology. This involves everyone. No one group of people is going to be able to solve this problem. It's a truly collaborative effort. We've heard some novel ways of delivering education, some of which are delivered through ecancer and through other platforms, and I think that this is going to be the way forward. I think that there are some things that we can be insightful and we can share practice on that we've done in high income countries. So we know, for example, that lung cancer, one of the world's most preventable cancer, we know that the vast majority, I think it's 80% of the world's billion smokers live in low and middle income countries. And we know that some of the most useful policies are fiscal policies to reduce cancer, to reduce smoking rates. So I think that some policies like that we have in high income countries, plain packaging for cigarettes, etc., can be adapted to these settings. But I also think that they also have unique problems that we don't have here. There are different cultural settings, different stigma in different ways associated with cancer, and also co-pathology, particularly with infectious diseases such as HIV. So I think that whilst we can learn from what we do in this country, I think that we also need to have other ways of thinking about this, and we can also learn huge amounts from our colleagues in low resource settings. I think that a meeting like this, I hope, has been a platform for education, has been a platform to raise awareness, has been a platform for people to form collaborative links with low resource settings. And I hope that it's been inspiring, particularly for the young generation of healthcare professionals of the future, so that they can form lifelong partnerships in these settings.